Welcome to Bright Ideas Dragon's Den. This is our invitation to our staff in Health and Community Services to come along, give us their bright ideas. We look for new business cases, and we've invited 5 sector colleagues to come along and tell us what their ideas are and see if the Dragons will say yes or no. There's £10,000 up for grabs for each one. Let's see what happens.
This is the Dragon's Den, where up to £10,000 is up for grabs to those who have innovative ideas to help HCS deliver improved services to people across the county. In the Den, each pitch lasts no more than 5 minutes and is followed by a Q&A session. The Dragons are looking for pitches that show your commitment and passion, evidence that your idea meets a need, and a longer-term vision beyond the trial period. First into the Den is Stuart Bertram with his bright idea for a mobile phone and tablet app.
Good afternoon, Dragons. My name is Stuart Bertram and I'm a project manager with Hertfordshire's Health and Community Service. And I'm here today to ask for an investment of £10,000 in exchange for a 100% equity stake in my business idea, Your Hertfordshire. Your Hertfordshire is quite simply a mobile phone application that acts as a portal to all the information and advice relevant to Hertfordshire's Health and Community Service. So why a mobile application? Why do I think Hertfordshire should need this? It is totally customisable to that individual. That means we can easily connect with applications that can transfer speech into text and vice versa. We can access video and audio information which covers a huge range of people with disabilities and impairments. It is a one-stop shop. It is accessible 24/7. So what's the future for the app? There are key opportunities for partnership working, particularly with health. And one of the biggest things that we will be able to do in the future is access your personal budget at any time. Thank you very much.
Thank you.
After each pitch, the Dragons confer amongst themselves before coming to a decision on whether to invest or not in the bright ideas that they have heard.
Okay, thank you very much, Stuart. Thank you for coming back. In essence, we feel that it's a good proposal and that we think that the development should be taken forward. So we are going to present you with the £10,000 you've asked for today. However, one of the things that we do want you to consider, making sure that the figures that you've described to us stack up and that we suddenly don't get hit with an ongoing bill with what needs to be done there on after. So if that makes sense to you, we'd like to award you your £10,000.
Thank you very much. In cash.
Also in the Den today were Richard Blake and Shani Hutton, who had separate plans to utilise and organise volunteering across the county from both private and public sectors. They both left with investment and advice from the Dragons. A group pitch by Chris Saunders, Jackie Chase, Lucy Hicks and Sheila Cox proposed a short break social skills programme inspired by the Great Leap Forward initiative. The Dragons liked the proposal and granted them funding to buy equipment for the scheme. Last into the Den is David Price, who is pitching a pilot project to review prescribed medication.
I'm here today to ask for £10,000 investment in my bright idea, home-based medication reviews. Before we start, I just want to show you something. This is the medication that I took out of my cupboard this morning. Now, only one of those related to a prescribed medication, and this is a fraction of what I got at home. This is the medication from a colleague's husband, and this equates to 2 weeks' medication that this person receives. So you can see there's a range of Dosset boxes, containers. So when you think about medication, there's a lot of it about. How will it work? Bright Idea funding would directly pay for staff, so this is backfilling staff in pharmacists. It would cover for the pharmacists so they can go out and actually carry out the medication reviews. So what is it? It's a pilot project. With £10,000, we would be able to review prescribed medication by a qualified pharmacist. It would be intended for people who are unable to leave their home and as a result are isolated and vulnerable. So the idea behind this is it pays for the staff time. That means there's an incentive for the pharmacist to do what they really want to do, but they're not able to, for the people who can't get into the pharmacy. What it would mean is those most vulnerable people who can't attend these appointments actually get access to those reviews.
If the pharmacist does the review, would the volume of reviews that are required reduce in any way, do you think?
So the benefit for us is when is the crucial time to carry out a medication review? I believe it's when somebody's at their most vulnerable, because that's when things go wrong. Starting point has to be the health and well-being of individuals receiving medication.
Okay, thank you very much, David. So if you could step outside for a few minutes, we can.
Hello David, thanks for coming back in and thanks for your presentation that I think we all agree was very detailed and very thorough. A nice quick answer for you. We've decided that as long as this is done in partnership with health and that there's outcomes that can be fed back to HCC following that, we are happy to present you with £10,000, which we have here.
That's great.
Well, we've had a great Bright Ideas session today. I think we're giving away just over £30,000 for great ideas that our staff have come up with. Maybe you've got a good idea for next time. If you do, the contact details are coming up next.